This patient has already been sedated. We're just doing the oral exam now, which is facilitated by the sedation that we've already given. We went very light on the dose, as we always do. We may have to augment the amount that we've already given, so he may react a little bit. So for now, what we're doing is doing things like checking the gingival pockets. They look good. Anything, 2 millimeters, a millimeter, he's under a millimeter. These teeth actually look good because his owner is very good about brushing his teeth. The problem with brushing teeth, it's great, we strongly encourage it, but the problem is most dogs don't like the most important teeth to be brushed, and those are the molars, because they actually chew at the molars. These teeth here, the incisors and the canines, are actually used for catching their prey and eating it. Well, most dogs don't have to catch the dog food in their bowl and eat it, they just go and eat. And so where the problem areas are in the back, but we're checking here in the front, and he doesn't show any signs of gum disease. We're taking a little bit of plaque off here. Gingival pockets look good, about 2 millimeters. We'll note that in his file. They actually look really good. The enamel looks nice and healthy. And I obviously left this light on from when I was working in the coal mine earlier today, but it comes in handy here for dentals. Very little. You can actually, I don't know if the sound's picking this up, but part of what we go by is sound. I'm getting very little tartar off, but a little bit. It's not bad to do. The main thing I'm doing now, though, really is the exam. I'm checking under the gingival pockets. They're all fine. No signs of gum disease at all. We also look for things like epilytes, which are growths in the mouth. We're not seeing any of those. Looking good, looking good. Let's come back around front here. Awesome. One thing we don't do, obviously, we don't use anything other than hand scalers, so it takes a little longer, or hand implements, including scalers, elevators, things like that. We can do minor extractions. Chico doesn't need any. Again, our gingival pockets are great on uppers and lowers. And we monitor him continuously. His heart rate's great. His breathing is perfect. Yeah, perfect. This is always the toughest tooth. This is the carnassial tooth, the biggest tooth in terms of surface area and roots. It has 3 roots to it. Sometimes it's mistaken for being 2 teeth. This sedative is reversible, so if he were to go into any sort of distress, we could reverse him. Or if at the end we feel like we want him to wake up, we can do that. Typically, we like to let them sleep it off, though, because there's also a pain-killing effect that goes along with the sedative effect of this.
Will they be in pain after they wake up?
Well, it should diminish. Again, we're not extracting any teeth. If we extracted a tooth, then we would talk about analgesics or painkillers to give them, but we're not extracting any teeth. It's more like, if you've had a teeth cleaning, you kind of have that little bit of a sting that lingers, so not really pain. But
And how often should we do this?
That is a really good question. So certain breeds are more prone to having dental problems. If you can move your, thank you, Christina. So it depends on the breed. It depends on how well some owners, like this owner, is very good about brushing, as we can tell. A lot of times our other big problem tooth is the canine. In his case, that's not the case at all, because the owner has been very good about brushing his teeth. So it depends on that. It depends on, some people suggest that well water, for instance, can cause deposits. I've seen a correlation between dogs that get well water. It seems like there are certain minerals and substances in the water that can exacerbate the condition of the teeth. In general, about every 2 years is a very, very much a ballpark figure. Some dogs never need their teeth cleaned. Some dogs need it every 6 months. So breeds that are known to have problems with their teeth are the sight hounds. So that's greyhounds, Afghans, Whippets, miniature greyhounds, Salukis, Borzois. Those aren't exactly everyday breeds. Mainly greyhounds, Chihuahuas, Pomeranians. Those are kind of problem breeds when it comes to teeth, so those might be ones that we need to do more of.
Do you, what is your recommendation? Should owners be brushing their teeth daily, every other day?
Great question, as much as they'll let you. Some dogs like it. I had a dog who actually really liked it. When we developed, sort of cultivated that desire on his part from a young age. Every day, if they'll let you, absolutely, just like humans. If they'll only let you once a week, by all means, we don't want you to get bitten. Don't feel guilty if you can't brush your dog's teeth, and I certainly wouldn't start like vigorously brushing a dog's teeth. If they already have plaque built up, brushing their teeth isn't going to do much. But a good time to start brushing would be after their teeth get cleaned, whether we do it or it's done in a classic clinic setting. The big difference between the way we do it and the way clinics do it, we don't put the animal under general anesthesia. And when I say animal, I've cleaned teeth on dogs and cats, and I have extensive experience floating teeth, which is kind of similar in horses. The big difference is with the way we do dogs and cats, we don't intubate them, we don't give them general anesthesia, we keep them, as you can see, lightly sedated, and so it's safer to do it this way. And again, as I indicated earlier, if he went into any kind of distress, I've been continually checking him. Christina, I'm sure, has been checking as well. Then we would reverse him. The one thing that we don't do, we don't polish teeth, because the polishing tool, like the power scaling tool, can cause auditory stimulation. So the main benefit of polishing is to seal off the enamel tubules after you scale, and also to make the teeth look pretty, gleaming. So we can't do that, but if you start brushing right away, it's not as important for those enamel tubules to be sealed off, because if you could do it on a daily basis, you're inhibiting the plaque from forming. So you're keeping those teeth as clean as possible without the enamel tubules being burnished.